not share the breakout room recording. Please keep your microphone off in the plenary session. Feel free to turn the camera on if you'd like. During the main session, you can ask your questions in the chat. In the breakout rooms, you are very welcome to speak and share your views with the mic. We will later share a curated version of the slide deck, meaning that we will incorporate the things that we will create in the breakout rooms into the slide deck. So a brief overview of our program today. We will start with a brief introduction to the Candle project by our coordinator, Li-Fang Liu from Health AI. And since our project is all about building national cancer data nodes, Johanna Antela from FICAN will introduce you to this concept. Then we will get started with the interactive work. We promised you that we will build personas together. I will introduce you to the persona concept and how this activity will work within the Candle project. And then we want you to get active in the breakout rooms. These will be moderated by Sukuma Mushi from Charité, by Jack Latour from ECHO, and by my colleague Griselda and myself from Empirica. Then after a short coffee break, we will report back from the breakout rooms, and then we will wrap up and discuss the next steps. So with that, I'm handing over to our coordinator, Li-Fang Liu, to give you welcome and introduce you to the Candle project.
Thank you so much, Carola, and good afternoon, colleagues. It's really an honor to be with you introducing the Candle project. So Candle is abbreviation for cancer data, national cancer data developers. So we try to, we also have the meaning that we want to shed some light to solve some problems of the data sharing. Okay, next slide. Thank you so much. So in some of the communications, I've been asked, so why you need a national cancer data node? We have our institute coordinating the data that generated for research projects. However, those data are generated on the institution level can be better streamlined on the national level. And the people who generate those research data can talk to each other and bridge the information or capacity bridges between institutes. Basically, it's a mechanism to help people on the national level to work better together and to speed up the research. And one of the problem as a researcher I always encounter is, okay, I need to find data there and another data there, and I want to combine them. So the problem is fragmentation. And in the National Cancer Data Node, we try to take the advantage of the European health data regulation to really streamline that data access through this regulation. And you can see the right part of the picture, which shows was the vision from the European Commission regarding National Cancer Data Node and the two important platforms. One is called ECPDC, that's European Cancer Patient Digital Center, focusing on the patient information, patient-reported outcome, and long-term follow-up of cancer patient. And on the right, that's the UNCAN.eu platform. It's really it's a federated EU platform encouraging national cross-nation collaborations on cancer research, and that needs streamlined data sharing within the country and across the country, and that's really the core mission of Candle and national data nodes. And Candle has the function, has the mission of linking these two platforms through the national mechanism. Next slide, please. And we are of 40 partners from 20 countries, and we kicked off this year in June. So we are at month 6, and one of the key words in the Candle project is synergy, because we don't want to build anything new that is already existing, but we really build on the existing infrastructure solutions from EU infrastructures, for example, Elixir, BBMI, IATRIS, and IRIN, ACRIN, Euro Bioimaging, and more, and also linking with a lot of EU-funded projects to bring the users' needs to the infrastructure developers and vice versa, to basically encourage the users to have more common tools and service to speed up and improve the quality of their cancer research. You see a lot of logos on the bottom. Those are our partners. So next slide, please. So in a nutshell, what Candle is doing from the left side, we are supporting these two platforms, uncan.eu and ECPDC, and we put the data users, all of you, in the middle of our project. And you can see the data users categories here are very much in alignment with our personas webinar incoming. So we like to hear from you what exactly is your needs for infrastructure for the National Cancer Data Node to deliver for you. So on the right side, those are basically our deliverables. First, we want to understand what is a cancer data node in your country. And that work package and deliverables is led by FICAN, led by Johanna. She will give more detailed input on that deliverable. And the infrastructure is really users driven. So we really want to build something both functional and also need to be very close and very tailored to the support the users needs in research. And we also realize every country has its own healthcare system and the way the research is conducted. So we want to create a network of national cancer data node to learn from each other. And we also try to help the member state to understand how ready they are to have a national node and what functions are missing, what are the national priorities to build such a data node. And we also want to bring those improvement or maturation level into a training program or signal the training needs for the national cancer data nodes. Basically, we are there to support the member states to build the national cancer data node to support the data users in the middle. Next slide, please. Yeah, I put a topical user there because AI seems to be everywhere nowadays, and we want to see how the National Cancer Data Node can support AI builders and users. And the national node is not only a concept. Last year, in the proposal phase of Candle, we already identified several models through talking to 20 member states. So we identified some models. For example, some countries like Finland are more centralized in one organization, which has been mandated by their ministry or their government. And in the Netherlands, we are really built on the national nodes of research infrastructures like the organization I'm working for. And some smaller countries are more built on their leading institute, the cancer research centers. And in some countries do not really have a national healthcare system. They prefer to have some flexibility building regional nodes to support regional research and then overarch on the national level. And some countries are more built up from the basis of cancer registries or population-based registries. So if you are interested, we have a poster of how the data nodes are right now in the 14 countries. You can see on the right side, there are a lot of disparities across Europe. So we will not design a one-size-fits-all solution for the national nodes, but really works with the member states to build the node according to the needs of their local community for cancer research. Next one, please. And so in terms of function, what functions are needed from the Commission? We understand there are 5 core functions the national node should have. The first one is to provide tools to improve data quality at source. which is very important because that's really the fundamental benefit from the national node. And then we need to provide tools for data analysis using in the SPEs. And there are many discussions right now in TADAS or EHDS how the SPEs should be designed and facilitate the users. And then every cancer data set should have a metadata record on the EU catalog. The fourth one is to give advice on common data models. So that's one of the functions of the national node. Last but not least, as I said before, we will create a network of national nodes to speed up learning from each other. So capacity building at the national level is one important element of the project. Next one, please. And today we are sitting with you to understand the personas, feature, and the needs from different personas category. And this is the slide showing which stakeholders we are engaged with on the national level for the National Cancer Data Node. And in the middle, you can see all these functions. Basically, we interact through those functions already on the data level, and let's build up the national nodes together and really taking into the account of users' need, because the national nodes is really user driven, and we want to align as much as possible with EHDS so that we can build on the regulation and streamline the data accessibility much more efficient across Europe. Thank you so much. I think that's my last slide.
Yes, it is.
Thank you
very much. Okay, so Li-Fang already contextualized this whole concept of National Cancer Data Nodes a bit and what our mission is in that. But now we're going deeper into this, since we want your help today to help us understand better which user groups would use these nodes. So in order to do that, Joanna Antila will explain more to you about the definition of National Cancer Data Nodes. She leads the word package, which is responsible for defining those nodes.
Thank you very much, Carola, and good afternoon, everybody. Here you can see the objectives of the National Cancer Data Node related objectives of CANDOR project as we are developing the NCDNs during this project. So we are conceptualizing the National Cancer Data Nodes at different levels, which are technical, operational, policy, and ELSI levels, and also addressing all the time all of the user needs. And we are also ensuring NCDNs are interacting seamlessly with ancan.eu and ECPDC. And we are also keeping very important notice of the EHDS compliance and developing tailored national roadmaps to guide NCDN implementation. And one important factor is also to establish continuous policy dialogue with different stakeholders to drive a really good development of NCDNs and also enabling the scaling up of the NCDNs. And through the CANDLE project, we will also develop research kit and facilitate the collaboration of different NCDNs and build a network of NCDNs. Next slide, please. And during this project, it's really important to define the users and user needs of NCDNs to be able to define different needs that are needs for the NCDNs from different perspectives. And the expected NCDN users can be categorized into 5 different groups according to the ECOS project. And the groups are academia, healthcare system, industry or private sector, government and authorities, and also patients and civil society in general. And these NCDN related needs of the users are defined via, for example, this persona development today and later on, and also by conducting different surveys. And at the moment, we have first of the surveys during the project ongoing, and it's sent to different member states. And the defining of the users and their needs ensures that the NCDNs will be relevant and functional, and of course also compliant. And this will shape the structures of the nodes and guide the functional requirements of the nodes. Next slide. And according to the eCancer, the national cancer data nodes are hubs that coordinate and support national cancer data holders by ensuring data standardization, quality, and compliance with EU regulations. And NCDNs will also act as an interface between national cancer data holders and EU, uncan.eu, and EHD ecosystems. And there are different options how the NCDNs can be established. They can be new entities that are created, or then they can also leverage already existing national cancer structures which have relevant expertise and capacity. For example, cancer registries could be one option, or then national or regional cancer institutes too. Next slide. And as Li Fang was already in her presentation explaining, eCancer Thematic Working Group has identified these core functions of national cancer data nodes. So functions that national cancer data nodes should carry. One of them is improving the data quality of cancer data at source. Second one is the ensuring all cancer data sets have metadata record in the EU dataset catalog. Then also developing common dataset variables for cancer datasets is one of the functions. And as a last one is providing tools for cancer data analysis to be used in the SPEs. Next slide. And there are different EHD body options for the NCDNs also defined by the eCancer group, which are health data intermediation entities, which are entities that facilitate the data and information, cancer data information. And then the second one is thematic health data access bodies, HDAPs, that provide the permits. And as the last one, there is the trusted health data holder, which then holds the data and also provides the secure processing environment. Next slide. You can skip this, Li Fang went through this, so we can go straight to the example of Finnish national cancer data node preparations. So a little bit about what is happening and what's the status in Finland currently. Finland has a long history of enabling secondary use of health data through the FinData system, and we are strongly involved in TEHDAS 2 joint action supporting harmonized implementation of EHD legislation. And we have very long cancer registry history, as the Finnish cancer registry was established already in 1953. And we have strong experience of different big data projects that require integration of different health data setups and also complex genetics data in the SPS across multiple regional stakeholders. And for example, Cancer Registry, FinOMOP, ICAN National, and FinGen are part of these dataset networks and harmonization and metadata concepts. And also tools for cancer data analysis that is done and will be done in the secure processing environments are continuously developed in ICAN, which is Digital Precision Cancer Medicine Flagship Project, as an example, and in collaboration with research institutes, infrastructure like biobanks and CSC, which is part of Elixir, and also imaging, Europe Bioimaging Network. And part of this Finnish national cancer data nodes will be us FICAN, hospitals, medical universities, FinData, biobanks, the Cancer Registry, and also Finnish Institute for Health and Welfare, and also CSC, which is the IT Center for Science. And our national cancer data node is already supported by Ministry of Social Affairs and Health, and the Finnish cancer strategy is also now actually already published and will be part of the function of the National Cancer Data Node also. Yeah, thank you. That's the presentation.
Yes, thank you very much, and thank you also for keeping the time. We will stick with timekeeping today, and we will we'll make sure that that we have enough time for your interaction. For the interaction exercise, we will start now. So I think an important point to take away here is that the National Cancer Data Nodes really want to serve you, the cancer data users, cancer data community in the widest sense, and that we are very, very engaged not to replicate structures, but to integrate this with existing structures from various areas as best as possible. So now I would like to introduce you to the concept we want to work on now. We think the persona method is an excellent method to understand which users might use the nodes and which users might benefit from the nodes. I will introduce briefly to you what the persona concept is, and then how we will work on this today with you. So personas are fictional characters that represent user groups, and they help us to put a face on user research. They help us understand and emphasize with stakeholders their needs, experiences, behaviors, goals, etc. There are already some excellent examples of personas from other projects. I put some here below from projects like V4AHA, Beamer, and Gravitate Health. These personas you see here are more related to concrete user devices or user-facing services, so to say. In my research, I haven't found so many related to cancer data. This is something we will work on today. So how will we work? We will develop 4 personas today. These personas we selected based on your work, based on your votes when you filled in the registration form. Thank you for that. These 4 personas today are not all personas we will develop. We will ultimately develop 1 persona per user group. Today will be an initial draft, only a start that we will work on in 4 personas, which will be research organizations, cancer registries, patients, research infrastructures. In later phases, we will develop more. So here we understand these 4 groups as representatives of these organizations or representative of these groups. By building these personas, you will help us to better identify the user groups, just like Johanna said. You will help her and her team to better define the National Cancer Data Nodes and the users they will be serving. You will also help us to create a good communication tool, which the personas can be used for to engage the community in a more relevant and social media friendly also matter. It has also worked very well for the other persona that I just showed from the other projects. So here are our initial personas we suggest. As I said, work in progress. You are helping us build them. First, we have Vanessa, who is a patient representative representing the group of cancer patients and survivors. Then we have Jakub, who represents a research organization like university hospital, cancer center, public research institute, etc. Then we have Kim, who represents the cancer registry. And we have Celine, who represents a research infrastructure. Of course, we are aware that many of you will think now, okay, within these groups, there are many possible subgroups like different staff categories in an organization, or patients of different age, patients of different digital affinity, and of course, patients and survivors have also some distinct characteristics. Yes, we are aware, but we need to start somewhere. Today, we will work with these 4 broad categories you find here. In your activity, we will do now, you can write on the sticky notes if you want to give some differentiation, for example, for younger patients, for older patients, or for different staff categories as a research organization. You can do it then in the rooms. So how we will do this? So to start with, you can choose your own breakout room now. If you are joining on a cell phone or a tablet, you might not be able in Microsoft Teams to choose your own breakout room. If this is the case, please write a message in the chat, and then we can assign you manually to a breakout room. Let me explain a bit further. We will work in 35 minutes in the breakout room. You can choose your own room as soon as we open the rooms. To do that, you will have to click on the icon for the breakout rooms, which will appear on the top bar here in Microsoft Teams. And then you have the selection of the rooms that you can join. I apologize that this is in German, but this is similar to what it will look like. Yes, if you are connected on a mobile device, I already told you, you might not be able to do this, what I showed in the screenshot. So please talk to our colleagues, Griselda and Alexander, and they will assign you then. How will we work and which tool will we use? So we will use Mural. Every breakout room will have its own Mural. You will have a table for the persona, and you will be able to add sticky notes for different areas. First of all, the goals. What does this user group want, or this persona want to achieve? What is their motivation? Of course, related to cancer data, related to everything that could be an interaction with the National Cancer Data Node and beyond. Then the pain points. What hinders this persona in achieving their goal? And what is their biggest problem when trying to achieve their goal? The needs. What do they need to overcome these pain points? And the skills, what are the skills they can apply and the skills they have? So you see this table here, it will be bigger once you are in the mural, and then you can put sticky notes in the respective areas. You can add sticky notes in 3 ways. I put it here, but the moderators in the breakout room can also explain this more to you. So we put some sticky notes already in the mural, which you can just fetch. You can also do a right click and then click on the content menu, add content and choose a sticky note. And you can also press Alt and do a double click. And please, in the breakout rooms, we encourage you to also take the mic and talk about your ideas and what you would like to contribute there. The moderators are there to guide the discussion and to manage the mural. Afterwards, we'll come back to the plenary after 35 minutes, and then we will debrief on all of this. Okay, so now would be then the moment, Griselda, in 1 minute, I will ask my colleague Griselda to open the breakout rooms. Then please choose your room and go there. If it doesn't work, our colleague Alexander will be here to assign you to the respective room. And we will get back here at 3:10 Central European time to get back to the plenary. Okay, so Griselda, please open the rooms. And for those of you who are not transferred to a breakout room the way they wish to, please just stay there and our colleague Alexander will help you. Welcome back, everybody. Then let's report back from the breakout rooms. Can you see my screen from the research infrastructure mural now?
Yes, we can.
Okay, great. Okay, so I will start with reporting back this from this room, and then we'll pass on to research organization. So we started by clarifying again the concept of a research infrastructure, also with the differences to research organization. The research infrastructure provides services to researchers and manages these infrastructure rather than doing research themselves. And that's also what Celine does in her role as a research infrastructure. So our general role is her general goal is to provide services to her researchers and to enable them to find the data they need, to be able to reuse this data, to have good metadata for them so that they find the data more easily. They want to support them performing their tasks, to emphasize the importance of fair data, etc. These were some of the main goals that were pointed out here. And with regards to the National Cancer Data Node, she wants to find out how the nodes of her research infrastructure will interact with her, with the National Cancer Data Nodes. So the pain points that hinder her from achieving our goal have a lot to do with inconsistency and silos, for example, inconsistent data, missing data, different data structures. heterogeneity of provenance and metadata, inconsistent standards, data silos, but also more on the human side, lack of support from data holders who want to, who might not be comfortable with sharing their data or their metadata and do not want to be bothered with needing to work for this. The need she has to overcome these pain points, some of which were mentioned here, were more definitions and more use of standards, semantic and structural, specific things like more resources for data holders to invest efforts into data standards. Use of specific standards was mentioned, like ISO 23494. Clarification of the roles of other entities like ERICS, besides ERICS, like edX, overview of different data sources, management support and define data from different sources, were some of the things that were mentioned. The skills that Celine has in her role are mainly related to data stewardship, data science, and software engineering, like knowledge on data they're holding, domain-specific knowledge, ELT, the ETL or ELT process interoperability standards, and related to the European Health Data Space, we noted that her awareness of the EHDS and what the EHDS prescribes depends a lot on what her role in the organization is. So all of this will be shared in a curated version of the slide deck later, so don't worry, you can read all of this again. Now I'm passing on to Griselda, who will present the results from the group representing the research organization persona.
Well,
we can see
you can't hear me.
muted. Now
okay.
we can hear you.
That's
Yes.
fine. Okay. So we were discussing on the research organization persona. We have named him Jakub. He's a research organization employee. The main difference between a research organization and the research infrastructures that Carola just listed is that while the infrastructures provide services to support cancer research, the organizations are the academic institutes, cancer research centers, university hospitals that will generate, analyze, and interpret this cancer data. So we discussed a little bit on what would the goals of Jakub be, so what he wants to achieve, and pretty much all of them revolved around data. So having access to large quantities of high quality data, having access to clinical data, and having access to different types of data. As well as filling research gaps, having or accomplishing equal access of data, and producing some breakthrough innovative science. And then what would the hindrances towards these goals be? Some of the hindrances were identified across bureaucratic procedures, long waiting times, a little bit of blurriness with legal experience and GDPR experience, lack of information about the NCDs, and also low literacy on technical issues that are related to data repositories. Then we try to work on some needs to overcome these pain points. And some of these would be some sort of ethical or legal support, fast data access, low or non-existent data hosting fees for research organizations, as costs of data hosting can be a big impediment. Having some sort of training accessible for research organizations on data curating, ethical reuse of data, and GDPR, as well as some sort of standardization procedure. When it comes to the skills that Jakub would need to achieve these goals, we identified things such as data analysis, browsing skills, and also practical information on how to apply for access of data, what kind of documents are needed, and how to fill in this paperwork to be able to access the data that is available. And as Carola said, of course, all of these points will also be shared following the meetings.
Okay, thank you very much. The next person, Jack, who will talk about the patient group. Would you like to share yourself, or should I share the board?
I'm happy to share.
Okay.
So has that worked?
Yes.
Fantastic. So in terms of the findings, I think in terms of goals, the main things that we had were access to better care and relevant health data, feeling heard and also empowered with access to data, more information on treatments, research, and rare cancers, contributing to knowledge generation, but also reducing fragmentation in care. The main pain, sorry, I should probably zoom in. So the main pain points, which is on the box on the left on the screen, were fragmented care and data sharing across regions, limited or bad access to information, complicated interfaces and low digital literacy, a lack of transparency and unclear data use, and also the need for trust and harmonized infrastructures. And the need to overcome these pain points were clear lay languaged information, early inclusion in decisions and co-creation opportunities of patients, trust building and advocacy support, structured and easy access to the digital platforms, and clear communication on how data is used. And also, yeah, I think that was a really interesting point as well in terms of making sure that people are very, very aware on exactly how their data is being used, if it's being put into the system, and that also the opt-out option is clear for people. And then finally, on the skills, we heard about basic health data literacy, understanding of research and data journeys, advocacy and representation of diverse patient interests, communication and dissemination skills, the ability to translate scientific information into accessible insights, and also connecting to regional and local patient networks and stakeholders. And I think one of the really main findings that we heard as well was that it's important that patients are involved from an early stage and not sort of as a token at the very end of a project where things have been kind of all defined. So I think having their input early and making sure that you hear from patients themselves and not just make assumptions on what they want was also something that was very strongly shared. So thank you for the findings.
Okay, thank you very much. And then lastly, Sukuma, would you like to share your screen yourself or should I? You are still muted.
Yes, thank you very much. I will share as well.
Great, go ahead.
So you should see the screen by now. To begin with, thank you very much for this group to just storm into filling the columns of this workshop. And here is the result. So the the cancer registries, as other registries, are not exactly almost at the center of things, but they are really interconnected. And I think this is one of the findings of these workshops regarding the cancer registry persona, how interconnected it is and how much interests are shared. Now, in terms of the goals, I tried to cluster it a bit. A lot of these goals were related with data. So it's key to have high quality data, and I think this is shared. How can you guarantee that this information is reliable? And integration also of all the players in the process is important for a cancer registry. But it's not only the data that is important. Cancer registry persona seems also to care about the patient and maybe even an individual's patient at a certain stage. So the status of a patient matters. Also, more information beyond the data in the cancer registry could play a role in terms of case information, knowing which patient that is, and being able to follow also maybe as a reverse precision medicine, being able to follow the patient over a longer period of time for research or the quality of the data or the data as such. Additional topics that were mentioned here was, the compliance as a topic. Yeah, it's an important goal. It's also important to be able to report and do research and publishing as part of the exercise, but also education matters. And there's a hint on the importance of having data standards applied. Yeah. Then moving on to the next column, the topics seem to flow along all of these four lines. So again, as pain points, what was mentioned already, the data is really at the center. It needs to be reliable, of high quality, but at the same time, data is getting more and more complex. And it seems that the persona has identified additional pain points regarding, data is not data. There's a mismatch in quality and completeness of the data that hinders the work of a cancer registry, but also the timeliness in the process linking to a workflow of a cancer registry is important too. So there's a call for workflow integration and also motivation of the parties to provide the data quality, but also the question of how are the parties incented to accurately contribute to the process. Then on the technical level, software actuality plays a role. So there's a mismatch in the versions or the type of the software, which is a pain point in the process and also not helping the topic of synchronicity. And of course, regulation add to complexity. How do you do the process with the appropriate level of security and privacy? Now, moving on to the needs. Well, it's sort of links to what has been said. So there's to overcome all the pain points and to be able to reach the goals, a high level of standardization at various levels of the process is needed on the data level, on the process level, on the software level, but also on the practice level. And there's a call of, let's say, the disciplines in a cancer registry to unite with the other disciplines to have a more global view on, let's say, the workflow, which should integrate in a much better fashion. Training could help there, which may be seen as a bilateral training for all involved. And benchmarking between cancer registries could also help to achieve high level of quality, of understanding and standardization and interoperability. Now, funding and incentivation was also mentioned here. So how could funding infrastructure be, let's say, more ramped up for cancer registries, but also for the other parties in the process that could help to overcome quality problems or, let's say, timeliness and so forth. And incentivation, of course, which is linked with money always. Moving to the last column, there were a lot of skills identified, and this sort of introduce also to a view that is a bit more layered. So the data level, the process level, for example, the content and let's say domain knowledge level, as well as organization level. So there are various skills, analytical skills, data abstraction skills, knowledge on even regulation that has been asked. So data management also at a lower level of the process, so to speak, data coding and analytics on the data itself, as well as, let's say, clinical and oncology knowledge for people that were not medical doctors, for example. So I think this has been quite a rich session. Thank you very much. And we'll compile the data and also will receive probably some comments afterwards from one or two people that had technical problems to join or to follow.
Thank you very much. Okay, it's interesting that even within this short time, we had some very distinct profiles emerging, but also some very concurrent topics. I suppose none of this is surprising. Topics like fragmentation, etc. Okay, we are tiny little bit over time, but I have two more points. First of all, thank you very much for our breakout room moderators, Griselda, Sukuma, and Jack. So our three parties, Empirica, ECHO, and Charité/Steinbeis, are the work package leaders of the stakeholder engagement work package here in Kendall. And talking about stakeholder engagement, we very much value the time you spend today with us, and we also value your time in stakeholder engagement. That's why we created a joint, or at least, linked stakeholder group for Kendall and our sister project EOSIP, which is more patient-facing on the Cancer Information Portal. you have the QR code here, but Griselda also pasted the link in the chat. You can, with one form only, you can join 2 groups or choose to only join 1 group, because we learned that you as stakeholders don't like to be spammed with very similar requests from different projects. Okay, and then as a last part, we would very much like to take a group picture. So for those of you comfortable, please turn your camera on. And then I ask Griselda to take a group picture and let us know when she's done.
Just 1 second, because the majority of the screen is covered by the slides.
Oh,
So
I'm
maybe
sorry,
then
I'm
it
still
would be
sharing.
good to
Yes,
stop.
okay,
Okay,
I shut up.
I'll take the picture right now. Just 1 second, because there are multiple screens of people. Okay.
Okay. Yes. Thank you again so much for joining and being so active in this. I'm very, very grateful that this worked so well. As I said, we will share a curated version of the slide deck and also the recording next week. And we'll also let you know how you can get in touch to be more involved here. And I wish you a very nice day. And thanks to our organization team, also for Alexander for helping with the breakout rooms, and to our 2 speakers, Li Fang and Johanna. Have a nice afternoon. Goodbye.
Thank you all.